Hi, Dr. King. Welcome. And this is the Flinders University Doctor of Medicine. This is Dr. Lani King, and she is going to give this presentation. Thank you for joining us.
Thank you. Thanks very much, Molly. So yes, my name's Dr. Svetlana King, and I am the Learning Coach Coordinator at the Flinders University in the Doctor of Medicine program. And today I've been asked to sort of talk to you about the importance of learning coaches in medicine. So before I begin, as is the usual practice, I'd like to acknowledge the traditional owners of the lands on which Flinders University teaches and researches across, in particular the lands of the Kaurna people where I'm presenting from today, and honour their elders past, present and emerging. So these images depict a range of activities. So we've got swimming, football, baseball, gymnastics, violin playing and athletics. And what's common across these activities is that all of these people have an individual who's guiding them and supporting them with their skill development to be the best that they can be in their particular activity. And the Flinders MD program is no different. So all of our medical students have someone supporting them and guiding them through the entire 4-year program. Oops. So we really see that ongoing learning is a fundamental component of good medical practice. So knowing how to learn is just as important as knowing what to learn. And this is really where coaching comes into the context. So what is a learning coach? Well, a learning coach is someone who supports a learner or a student to achieve their fullest potential. And they do that by helping the student to evaluate their performance, for example, by reviewing academic results, helping them to identify their learning needs, and from there developing and reviewing plans to address these needs. Learning coaches help students to remain accountable and also help them to monitor their own learning. So it's important to note that coaching is quite distinct from other teaching roles. So coaching is different from mentoring or tutoring around particular content or skills. It's different from counselling and also from advocacy. So in this role or in this coaching context, the student takes responsibility for their own learning, and it's what we refer to as self-regulated learning. So what does the coaching program look like in the Flinders MD? So at the start of year 1, every medical student is allocated to a learning coach, and they work with that coach for their entire 4-year program. So they work with the same coach over their entire degree. And in year 1, this starts with an informal meet and greet. So this is a sort of group activity, and the only group activity we have in the program in relation to the students and coaches working together. And this is really a chance to kind of have an informal discussion and get to know one another before the sort of formal learning coach interactions start. So in the first year of the program, there are 3 meetings that happen between the student and their learning coach, and they're one-on-one meetings. So there are 2 meetings in the first semester as students are getting used to the program, and then 1 meeting in the second semester. And then in the second and third year, students will have 1 learning coach meeting per semester. So 2 meetings per year with their learning coach. And then in the final year, there's 1 learning coach meeting, and that's really a celebration of the achievements that students have had over the 4-year degree. And the focus is really on supporting the student to prepare for internship after they graduate. So given the sustained involvement of the learning coach, the relationship between the student and the learning coach is really fundamental. And the student is really at the centre of the coaching relationship and the interaction. So you'll note that the student bubble there is slightly bigger than the learning coach bubble. And the student is in charge of and takes responsibility for their learning. So that idea of self-regulated learning comes in here and weighs quite heavily in that interaction. So to complement the coaching that students receive, students are required to maintain a reflective portfolio, and we use software called Mahara to do this. And in that portfolio, students will be reflecting on their progress. So they'll do that by reviewing the feedback that they receive on their learning and their academic results, to then identify areas for development, as well as focusing and celebrating their strengths and their achievements. And then they'll use those areas for development to develop the establishment of learning goals, and they'll be reviewing those learning goals in that portfolio as well. So that is really what we might call reflective practice. So there are different ways that students can engage in reflective practice. So they might be reflecting for action. So that's really a future perspective, so that they're planning the development of their learning goals and setting some targets in place to achieve those. Reflecting in action, so that's about being responsive to their development and progress towards achieving those goals. So they may be needing to make changes to the strategies that underpin those goals, and that reflection in action is a mechanism to help them make those changes. And then finally, there's reflection on action. So that's a retrospective look at how students have gone towards achieving the goals that they set for themselves. And through all of these activities, the learning coach plays a pivotal role in supporting students to maintain their portfolio, to identify feedback and respond to that feedback through the development and review of learning goals. So what do our students say about the portfolio and the Learning Coach initiative? So we have Melissa here, who's a current Year 1 student. So she says, with the fast pace and high expectations of the course, it can be difficult to reflect on your progress and identify areas for improvement. By documenting the steps I take in reaching my goals, I can see what works and what doesn't, and that makes her learning more efficient, and she can be more independent. She sees her learning coach as a mentor who provides their unique perspective on her progress, adding another dimension to her overall development as a student. And then we have Ben, who's a current third-year student, and he's noting here that he finds the robust conversations that he has with his learning coach particularly useful, and helps him to maintain an awareness of the areas that may not immediately be within his focus. So the coach's role there is really assisting to identify blind spots and helping students to identify those. He sees the learning coach role as an ongoing presence and an avenue for support, and he genuinely looks forward to interactions with his coach. Okay, so what do our learning coaches say about the initiative? So this is Dr. Lani. She's a general practitioner or a family medicine doctor, and she joined the program as a learning coach this year. And she says that medicine's changed in so many ways, and to have a go-to person when things get a little tough or just to bounce ideas off is a great way to sustain mental health and longevity in the profession. She's had very warm interactions with her students and has been able to address lots of issues, not only within the medical course itself, but also life in general. And so she finds it a really wonderfully rewarding role. And I'm certainly biased, but I think being a learning coach is an absolute privilege. And I really find that that's the most rewarding part of my job. So I really enjoy being a learning coach. And then we also conducted a research and evaluation project on our program last year. And one of the learning coaches mentions here, they've gone from being new medical students to being people who've got their plans for continued lifelong self-regulated learning with ongoing learning goals that they've now set themselves well beyond the medical course. It's very impressive to see that. And certainly having that long-term relationship with students is a really fundamental component of this whole program, and it really is wonderful to see how students develop themselves over that 4-year program. So in summary, learning coaches play a really integral role in supporting students to engage in reflective practice. And they do that by helping students to reflect on their development towards our course learning outcomes, by identifying and using evidence from various sources, including academic results, as well as feedback from peers, educators, and patients to inform their learning. Learning coaches also help students to identify areas for development and then establish learning goals to address those areas and then help them to close the loop on those learning goals. So at Flinders, we really recognise that to be an effective and a competent doctor requires skills to be able to learn effectively and use every opportunity to grow and develop. So this requires a self-regulated approach to learning, and we see that that's important to inculcate at the beginning of medical school. This will enable our future medical workforce to provide high-level patient care through engagement in reflective practice. And this is something which has now been introduced and recognised as mandatory in order to be registered as a healthcare provider in Australia. So I hope that gives you an idea of what the Learning Coach program looks like at the Flinders MD program. And I'm very happy to take any questions by email or otherwise, but I wish you well in making your decisions.
Thank you, Dr. King. That was a wonderful presentation. If anyone has any questions, they can add them in the chat here, or you can email them after or go back to the Career Eco. So thank you so much. That was really informative. We really appreciate you helping us out tonight and giving this presentation.
No worries at all. Thanks, Molly.
Thank you. Bye.
Bye.